Welcome to our in-depth exploration of imaging tests for chronic constipation diagnosis. Chronic constipation is a common digestive issue affecting millions worldwide, defined as having fewer than 3 bowel movements per week, often accompanied by hard stools, straining, a sensation of incomplete evacuation, or even abdominal discomfort and bloating. While many cases stem from lifestyle factors like low fiber intake, dehydration, lack of exercise, or medications such as opioids and certain antidepressants, it can sometimes signal underlying conditions like irritable bowel syndrome, hypothyroidism, neurological disorders, or structural problems in the colon or pelvic floor. If symptoms persist despite dietary changes, over-the-counter laxatives, or increased physical activity, typically for more than 3 months, it's crucial to consult a healthcare provider. Diagnosis usually starts with a detailed medical history, physical exam, including a digital rectal exam to check for muscle tone and impaction, and possibly blood tests to rule out systemic issues like anemia or thyroid imbalance. However, when alarm signs appear, such as unexplained weight loss, rectal bleeding, sudden onset in older adults, family history of colon cancer, or failure to respond to initial treatments, imaging tests become essential. These non-invasive or minimally invasive procedures help visualize the gastrointestinal tract, identify blockages, assess stool movement, and detect abnormalities that simple exams might miss. Organizations like the American Academy of Family Physicians and Mayo Clinic emphasize that routine imaging isn't recommended for everyone, as it could lead to unnecessary radiation exposure or costs, but it's targeted for those with red flags or suspected functional disorders. In this video, we'll break down the key imaging modalities, starting with basic ones like X-rays and CT scans, moving to advanced functional tests like defecography, and covering transit studies. By understanding these tools, you'll gain insight into how doctors pinpoint the root cause, whether it's slow transit through the colon, outlet obstruction due to pelvic floor dysfunction, or secondary causes like tumors or strictures. Remember, this information is for educational purposes. Always seek personalized advice from your doctor to determine if imaging is right for you and to interpret results accurately. Let's dive into the foundational imaging tests often used in diagnosing chronic constipation: abdominal X-rays and computed tomography, or CT scans. Starting with plain abdominal radiography, this is one of the simplest and most accessible tools involving low-dose X-rays to capture images of the abdomen. It's particularly useful for confirming fecal impaction, a buildup of hardened stool in the colon, or ruling out acute issues like bowel obstruction, which might present with severe pain, vomiting, or distension. During the procedure, you'll lie on a table while the technician takes flat and upright views. No special preparation is usually needed, though you might be asked to avoid eating beforehand if contrast is involved. The images can reveal a colon filled with stool, gas patterns suggesting ileus, or even complications like stercoral ulcers from prolonged impaction. According to sources like Medscape and Intech Open, X-rays are inexpensive, quick, taking just minutes, and widely available, making them a first-line option in emergency settings or for initial evaluation. However, they're limited in detail. They don't show soft tissue structures well and involve minimal radiation, so they're avoided in pregnancy unless necessary. Moving to CT scans, these provide more comprehensive cross-sectional views using multiple X-ray beams and computer processing. They're ordered when X-rays aren't conclusive or to investigate underlying causes like abscesses, tumors, or diverticulitis that could contribute to constipation. Preparation might include drinking an oral contrast agent to highlight the intestines, or receiving intravenous contrast for better vascular detail, and the scan itself lasts 10 to 30 minutes in a donut-shaped machine. CT excels at detecting structural abnormalities such as strictures or masses, and can even classify constipation severity based on stool distribution, as noted in studies from PubMed. Pros include high resolution and speed, but cons are higher radiation exposure, equivalent to several years of natural background radiation, and potential allergic reactions to contrast. Both tests help differentiate between functional constipation, where the gut works slowly without blockages, and mechanical issues requiring intervention. In practice, as per the American Family Physician Guidelines, these are reserved for patients with alarm symptoms to avoid over-testing, ensuring a balanced approach to diagnosis that prioritizes patient safety and efficiency. Now let's explore advanced functional imaging tests with a spotlight on defecography, which is pivotal for diagnosing outlet constipation caused by pelvic floor issues. Defecography, also known as evacuation proctography, uses either fluoroscopic X-rays or MRI to observe the rectum and anus in real time during simulated defecation. This test is ideal for chronic cases where patients report excessive straining, incomplete emptying, or manual assistance, as it reveals problems like pelvic floor dysfunction, where muscles fail to relax properly, or prolapses such as rectocele, bulging of the rectum into the vagina, or enterocele, intestinal bulging. According to Cleveland Clinic, the procedure starts with preparation. You might do an enema at home to clear your bowels, avoid certain foods or meds, and arrive in comfortable clothing. In the X-ray version, a barium paste, mimicking stool consistency, is inserted into the rectum via a tube, sometimes with additional contrast swallowed or applied vaginally for better visualization. You'll sit on a special toilet-like device while the table tilts, and as you squeeze, relax, and expel the paste, continuous X-ray images capture the process, lasting 30 to 60 minutes. It's open, so no claustrophobia concerns, but involves low radiation. The MRI alternative uses magnetic fields instead, avoiding radiation entirely, and can be done in an open or closed machine. You might expel into a diaper if horizontal, with ear protection for the machine's noise. Both versions assess anorectal angle changes, muscle coordination, and organ positions, helping surgeons plan repairs if needed. Risks are minimal, slight cramping from the paste or rare allergic reactions, but it's avoided in pregnancy. Mayo Clinic notes it's often combined with anorectal manometry, where a balloon-tipped tube measures pressure. Overall, defecography provides dynamic insights that static images can't, making it invaluable for unexplained chronic constipation, though it's typically performed in specialized centers after basic tests fail. This targeted approach ensures accurate identification of treatable causes, from biofeedback therapy for dysfunction to surgery for prolapses, improving quality of life without unnecessary intervention. Finally, we'll cover colonic transit studies and other specialized imaging, wrapping up with key takeaways on their role in chronic constipation diagnosis. Colonic transit studies measure how long it takes for material to move through the colon, distinguishing slow transit constipation from normal or outlet types. The most common method, as described by Mayo Clinic and Medscape, involves swallowing a capsule with radiopaque markers, tiny plastic rings visible on X-rays. Over several days, usually 5 to 7, you'll return for abdominal X-rays to track the marker's progress. If more than a few remain after 120 hours, it indicates delayed transit, often due to nerve or muscle issues. Preparation is simple. No laxatives during the test, and it exposes you to minimal radiation. An alternative is scintigraphy, where you eat a meal laced with safe radioactive tracers tracked via gamma camera scans over 48 hours, providing precise motility data. Barium enema, another option, involves filling the colon with barium contrast via the rectum for X-ray imaging, spotting strictures, cancers, or volvulus that obstruct flow. It's useful for chronic cases with suspected blockages, but can cause cramping and requires bowel prep. These tests aren't first line. AAFP guidelines stress they're for refractory cases after lifestyle and laxative trials, especially with no alarm signs. In conclusion, imaging tests like X-rays, CT, defecography, and transit studies offer a spectrum of tools to uncover constipation's causes, from impaction to dysmotility, guiding treatments like fiber supplements, medications, biofeedback, or surgery. However, they're not for everyone. Over-reliance can lead to risks, so discuss symptoms openly with your doctor. Early intervention often resolves issues without advanced imaging. Thank you for watching. If this video helped, like and subscribe for more health insights. And remember, professional medical advice is essential for your unique situation. Stay healthy.